Hi, my name is Amy Nat, and I am the CEO of Aging Outreach Services, and this is All Things Aging.
And I'm Amy Ferris, Editor-in-Chief of Outreach NC, our monthly publication. And today we're going to be talking about how to help parents navigate medical appointments.
Good topic.
Which comes up all the time.
It does.
All the time people write in and ask about, first, the fact that their parents have a lot more medical appointments.
Right.
And then how to help them keep them organized and how to help them navigate them and whether or not those appointments are necessary.
Right.
So it's really hard for adult children and parents to be navigating them.
Exactly.
All right, so I'm going to pummel you with questions.
All right.
Okay. So why is it important to have support during medical appointments?
I think this is true for any age, but particularly as somebody gets older and, like you said, may have multiple appointments, but those appointments can be very fast paced. The days when you walked in and, kind of had the attention of that doctor for as long as you wanted, that's not necessarily the reality anymore. An appointment may be 15, 20 minutes. And so I think it's really important to be organized and to stay on track with the things that you want to cover during that appointment. So having somebody that can help and kind of be a second set of ears and just be there to observe is important.
Do you talk to the person before they go in and say, hey, I just want you to make notes, write things down, or I want you to be interactive? Is it good to have that conversation?
So that's one of the things. You want to ensure that you're making the most of that appointment. When you're there, you want to ensure that information is getting reported that needs to be reported and that you're really listening and hearing, right, what the doctor is saying. Because sometimes you get home and the person goes, they remembered one of three things, right, that was said. And so yeah, one of the things that I like to do with somebody is to sit down with them prior to going to that doctor's appointment and really make a list of what are the things that have been going on, what are things that I want to make sure I address during this appointment. And if you can help the person make that list and sort of talk it through why there's more time and you don't feel like you're in a rushed environment or having white coat syndrome where your blood pressure's up and maybe you're nervous, it's much easier to go in and get the most out of that appointment because you can refer back to those notes.
So what type of support can like a spouse or another person provide?
Yeah, so I think just like you mentioned, helping to organize that information ahead of time, reminding somebody that, hey, let's get all your medications together and let's make sure to take those into in case there's questions. I think you can help that person to make the notes. It's a fine line. You don't want to take over, right, or be overbearing because that's going to really push mom or dad or your spouse away and it may feel like you're infringing on their privacy. So I think helping them, right, to make the notes, to remember the things that they want to take to the appointment, even driving them, right, to and from the appointment. Maybe it's somebody with mobility issues or it's a huge parking lot, that type of thing can be helpful. It relieves some of the chaos of it and helps alleviate some of the stress that can often accompany a medical appointment.
Yeah, I didn't even think about parking.
That's right. Yeah. Parking is a big one. And so if you can drop somebody off at the door and they don't have to walk as far, even handicap spots can be hard to find, right? If everyone going to the doctor is of that same age group. And so just helping them get that stuff organized and the day of the appointment, reminding them, did you grab your notes? Do you have your medications? Anything else that they're wanting. Sometimes I have clients that will have seen something in a magazine or online that they want to ask the doctor about, a supplement or various things, but just reminding them and making sure they have all of that with them on the day of that appointment and getting them to and from that appointment.
So those are good organizational tips. Do you have anything else to document or organize medical information?
Yeah, so I brought a couple things, but one of the things, and there's a couple different ways you can do this, one of the things that I like to do is have some type of, this is just like a doctor appointment planner. We can put the link below, but have something where you're really keeping track, right? If you have a doctor and you go twice a year or you have someone you see 4 times a year, it can be difficult to remember between appointments. And so having a place to document the day, the time, the date, and kind of those notes, right? What was discussed? Was there any significant changes? Were there falls? Anything like that. If you can sort of make those notes and keep it either in a book like this, or if I have clients, maybe they have 4 medical providers, right? So what I'll do sometimes is take just an old traditional 3-ring binder. I like paper to see things, and print out what would be in that guide and literally make a tab, right, for each of the providers. And so if I'm going to see my primary care doctor and he's asking me what happened during my last appointment with my orthopedic or with my heart doctor or whoever, it's really easy for me to reference those notes and see what was done without having to log into my portal, or sometimes there's 2 different medical portals and not every medical practice can see what was done in another one. So I prefer to keep it organized for my clients to have it, whether it's in, like I said, a traditional kind of appointment planner book, or whether they want something that they can really organize. And then some people, if you're really high tech, you could do the same thing digitally online. And just have that on your phone or tablet to take in with you. It's however that person really likes to keep information, but having those kind of summaries of that visit will help not only for you to remember the different things that you've dealt with since you saw your doctor, but it'll help you also keep your doctor educated on what your support system and medical providers are addressing for you.
I imagine that's as helpful for the doctor as it is for the patient.
Well,
you can
and
make the most of those 15 or 20 minutes.
Definitely. Or, if you think about if somebody ends up in crisis or going, to the ER or a walk-in clinic, or they're having some short-term crisis, it's very hard to think.
Right.
And there's people asking you a lot of questions. And so it's much easier if I'm like, grab my book on the way to the ER, or my adult child or whoever might be supporting me, right? If my mom's there and I'm like, okay, let me grab the binder. And that way, when they're in the hospital asking lots of questions, this way nothing gets missed, right? You have that information organized about your own healthcare. And I think that can be super helpful.
Any other tips for preparing for an appointment?
I think, like we talked about, the questions is the big thing, and making sure that not overlooking something like, oh, well, it wasn't really a fall. I just tripped and hit my head on the Like, those things are important. So I think remembering what the last few months really has been versus just how you feel in that moment. Your mom may say, oh, well, no, I feel great today. And you may say, but Mom, you've had headaches, 3 or 4 times over the last month. Maybe you should add that to your notes, kind of helping me, that record keeper, of what all has been going on, and making sure they know this is their time with that provider. It's okay to ask questions. I think there are some generational differences where people maybe didn't, they were just listening to the doctor. They weren't as proactive in expressing maybe what their concerns or questions were. So I think encouraging them to do that and make the most of that time, and reassure them that it is okay to ask questions or to question things, and be their own advocate.
Right. So that brings me to the question of, what is your role in the appointment?
Yeah. So, if somebody is completely competent and acting on their own behalf, they may let you help prep for the appointment, but they may want you to stay in the waiting room.
Right.
And that's okay. If they allow you to help them get the information organized and help with their notes, help get them there, but they prefer you to stay in the waiting room because that's their private information and they're not ready to share that with you, that's okay. You should give people the autonomy to do that. When that sort of changes is if somebody has an active healthcare power of attorney.
Okay.
All right. And so this is always a good point, I think, to make. I have a healthcare power of attorney, right? But that doesn't mean that person can just act on my behalf anytime. It means if, according to the wording of my document, my physician finds that I'm no longer able to make those decisions or incapacitated in some way, then that person, right, once I've met that criteria, can act on your behalf. So
they can't just call up and say,
right, well, I'm her power of attorney, right?
I'd like that in your records.
Yes, and people do it all the time, really? Yes. You get some crazy family dynamics or siblings or adult children that want to know what's going on with mom or dad, and mom or dad has chosen to keep that private. You can't just call and say, well, I'm her power of attorney.
Right.
That power of attorney has to be activated. And so that's a big difference in the boundaries of what I can do to act on your behalf. in one situation, it's what you're going to allow me to do because I don't have any legal authority to act. So I can offer my advice and assistance to a family member or loved one that I might be helping to navigate these medical appointments, but it's still their decision. And in the other scenario, if I am somebody's healthcare power of attorney, that person has been deemed incapacitated in some way or unable to make healthcare decisions, then I really have a responsibility to act on that person's behalf. And I would have much more of a hands-on role in helping that person navigate things like this.
So if you're going to go with your parents, for example, to an appointment, would you say ahead of time, hey, what do you want me to do in this appointment? How do you see this going?
Yep, definitely. Because what you don't want to do is alienate the relationship and have them not let you be involved at all.
Okay.
I think sometimes it's baby steps with somebody's comfort level. And one person may be very comfortable and say, oh, yes, I hate doctor's appointments. Can you please be there to take notes for me? Help me remember what was said afterwards. And other people, again, may say, okay, thanks for the ride, but, I'll be back out in a minute. So I think you have to be prepared for whatever, the person's comfort level is.
And what about HIPAA? Have you ever had a doctor not allow you to come in, or are there anything we need to know about that?
Yeah, definitely. So most of the time, when you go into the appointment, people are always asking you about HIPAA, and the word gets thrown around a lot. But if somebody really wants you to be their advocate and they're really still, at this point acting on their own behalf, they can still add you to their HIPAA form.
Okay.
So if you're in that appointment, then the doctor you are sort of have access to that information. This person has given you permission to be in there with them, to have these discussions. And so having, making sure that the people that you want to have that access are on your HIPAA form is important. Your parent may or may not want to list you, but certainly if they do, then that's helpful if you're trying to help them navigate.
So is this the form where I say who can have my records and all that?
I'm always like, oh, think carefully. Yeah, right?
Yeah.
Because, when you're feeling great and you don't have any issues, it's very easy to kind of think through those things. But when you end up in crisis, that's when you really need to think about, who is helping me navigate appointments. And unfortunately, like you said, sometimes as people get older, they tend to have more and more specialists, and it can get really confusing.
And I do see some people will start arguing with parents about the medication that they're on, or saying, I don't think you should be on that, or whatever. And it's important to respect the person's decision to follow their doctor's guidance, or to ask you what your opinion is.
People look so much up online. So Dr. Google has really made navigating medical appointments, I think sometimes, it's good and bad, right? Access to information, but that's where you can encourage, if mom or dad or you have read something or saw something, or your neighbor had this procedure done, that's really good to put in those notes to say, well, let's see what your doctor thinks for you. And helping them be organized as they go into those appointments.
And also I think I see a lot of people stopping medication or changing their medication based on what a friend did or what they saw on TV. And so being able to talk to them about it.
Yep. And encouraging them. We talked about taking the medications with them. So, one of the things that I found to be important and helpful, right, in helping to navigate these appointments is if you have, 1, 2, 3, 4 different providers, maybe you had a hospital stay, that's 4 or 5 different med lists and potential people prescribing medications. And so it's really important that your primary care physician know what all of those are and which ones you're actually taking.
Right.
Because like you said, somebody might have prescribed it, I never filled it, I'm not taking it, but maybe my, the information in the laptop they're looking at has it listed. So it's really, really important to reconcile that list. You can actually ask your pharmacist for a printout and look at that yourself prior to the appointment, like you said, preparing and go through and make notes of what you're not taking and getting that list cleaned up. And then you can share that with your doctor to make sure that your primary care doctor, especially, or any doctor, is aware of the other things you're taking, maybe from other providers.
And also any supplements.
Definitely.
Those get missed. Yeah.
Yep. Those get missed. And, I was just with a client at the doctor last week, and there's our advocate. And once we started talking to the doctor, it turned out she was taking like 4 different forms of magnesium, right? So not just the one in the bottle, but also some gummies she found and some other drink she had that had extra magnesium. And, luckily he checked her levels and it turns out they were a little too high. But those over-the-counter supplements that, again, you might read about or see a commercial or your neighbor takes it, so you try it. Those are really important to make sure your doctor knows. That's a great point.
What about online portals?
So most of your medical providers now will have some type of online portal. There's a couple of major systems that sort of keep those. And so, like I said, some talk to each other, some don't. But if you create a login, you can have access to all of basically your information. So the visit notes are there, the medications, any test results, any referrals that were made. But you can also message the doctor through the portal, which is great because what can happen sometimes is I'll be talking to a client and they'll say, oh, I waited 30 minutes on the phone trying to get through to my doctor. And I'll say, well, have you used the online portal? And they'll say, oh, I hate the computer. I can't ever get logged in. So sometimes I'll help them set that up. And then within 5 minutes, we can log in, send the doctor a message, and they're able to respond that way. It's a much more efficient way sometimes to communicate with that provider. And just like you asked about HIPAA, I could choose to share my portal with you if you're going to be my advocate or you happen to be my healthcare power of attorney, and then you would have access to that information as well.
I think sometimes the biggest barrier to online portals is setting them up.
Yes.
So just having somebody to sit and help you.
I mean, tech support. It's hard. And then even navigating them, there's a lot of different tabs, right? So like they may send out auto-generated messages that are just about the flu shot season, or they may be sending out a message very specific to you about a test result. And so navigating that online portal can be tricky. So if your parent is not a big fan of those, but they're willing to sit down and let you help them to see where that information is, it's helpful. And sometimes reading that doctor's summary of the visit, there may be things in that visit note that you didn't pick up on during the appointment, and it can really help you understand the bigger picture of kind of what your plan of care is and understanding, what the physician's focused on. I found a lot of information in those portals.
And also any corrections you need to make. Maybe your doctor heard you say one thing.
Right.
And you realize you didn't fully give context or they don't understand. I've also heard of a lot of people getting test results on online portals before their doctor has.
So I just did this. Yeah. I'm guilty. So the portal will send out a notification that you have a new test result. And I'm the worst about emailing or messaging the doctor, and they're like, I haven't had a chance to look at it yet. So the good and the bad, but yeah, you can see those test results right there. And the historical data is there. So if you're not a person who wants to write it all out, or you just want to keep general notes, you can always log back into that portal and have the, if there was blood work done a year ago, or maybe you only get a bone density test or a mammogram or something once every so many years. You can easily look back and access that data. Or if you do become healthcare power of attorney for a parent or a loved one, and you really don't have that historical data once that healthcare power of attorney is activated, that's a good way to access that information as well.
And it's a good way to save and store it. So what are some other ways? We've talked about the binder.
Yeah, I mean, those are the main. Some people will keep file folders and they'll ask for a printout of their visit. You can do that. You can organize it in a binder, or certainly if you prefer digital files, those portals are really great. And if for some reason you're whatever maybe if it's a non-traditional medical appointment or something and they don't have that online portal, you could still ask for the visit note and you could scan it in yourself if you prefer to keep it, organized in a computer that way.
So let's say that my mom broke her hip and now she's going to have to see several other doctors as a result of that. Would I want to get her medical records from her primary care and have those sent over to those doctors?
Normally they'll do it automatically through those portals. They'll ask you to sign something or ask your mom to sign something giving permission. So that's, that part is pretty seamless. But sometimes, like we said, if you're in the hospital, there may be medications automatically added that you never have taken.
Right.
They just didn't get taken off your record. So reviewing that information that was sent from one provider to another is really important. And that's something you can offer to help a parent do. You know, hey, do you want to go through some of these lists? Let's, make sure this is accurate so that you can correct something that's wrong.
And even looking up the names of what they are.
Right.
We use different names,
Yeah.
generic versus,
Definitely.
So we've talked about medication lists. Anything else there?
No, I think just reconciling those lists, making sure they're right, and even carrying it with you, right? So I have people that will put it on an index card written in pencil so they can change it, cross like an old address book where you cross it out all the time. So maybe carrying that medication list with you, or I have clients, I brought this nifty thing too. There are things, this mag is magnetic. It goes right on the refrigerator, and there's a great little list in here of medical conditions, allergies, emergency contacts, and you can list medications.
Oh, that's great.
So things like this, if EMS is called to your house, or someone is taking you to the hospital, they can grab this right off your refrigerator, take it with you, or if there's a list you keep in your pocketbook, especially allergies, right? Knowing if someone has a serious allergy to something or what their current meds are, it can be really helpful to have it accessible, but you have to keep it up to date.
So that's the last thing, is how to keep it all up to date and accessible. So
Right.
something like that, or just an index card.
Yeah, I mean, it's kind of what that person's comfortable with. I have a lot of people who just prefer the index card, but that's where, if it's somebody if it's my parent or somebody I see routinely, then once a month I might say, hey, let's just check your card to make sure all that's right. Or if I'm at the appointment with them and the doctor makes a medication change, then as soon as we get home, I could say, hey, Mom, pull out your card and let's make sure that's up to date. Because certainly there'll be basic medical records accessible in some electronic system, but again, you're your best advocate. And so making sure you know what that information is and having that information where you can review it and make sure it's accurate is super important. And that's where you can really be an advocate for a parent.
So final question.
Yes.
If you see that your parents are struggling or overwhelmed and you want to broach this subject with them, what are your suggestions for having that conversation?
So definitely picking, a time of day and an environment where things are calm, not in the middle of like family dinner or TV blaring, radio, like chaotic. Finding a time where, hey, Mom, let's go to lunch or let's have coffee. I wanted to talk to you about some questions or ideas I had. Notice you're getting really overwhelmed with all these medical appointments. Is there something I can do to help? And sometimes people don't know what they need.
Right.
So if
Or they don't know it's possible.
She's like, no, I'm fine.
Right.
You can say, great, here's some ideas for the future if you think you might want some help organizing them. I found this great planner. I could print it out for you, or I could help you, write out who all your physicians are, what your med list is. Like, have you logged into the online portal? Would you like me to help you set it up? Just offering them solutions for things that maybe they don't even realize are an option. And just, being there to support them and making sure they do know, like you said, that there are resources available. And, it's perfectly normal to feel overwhelmed and confused by not only the setting sometimes that you're in, if it's a medical setting and you're not really comfortable there, or the terminology being used and not understanding exactly what was said or feeling rushed, that it's okay for that to feel overwhelming, but there's ways I can help you.
Good. Thank you very much.
You're welcome.
Appreciate it.
All right. Thank you.